Let's follow up on this story now. The Democratic Nursing Organization of South Africa, Denosa, has welcomed the arrival of over 200 Cuban health experts in the country, but it's warned government should not overlook unemployed nurses here in South Africa who could also contribute towards the fight against COVID-19. Now, to discuss this further, we're joined via Skype by Denosa President Simon Hlungwani. Simon, a very good morning to you.
Good morning, and thank you for having us. Greetings to the viewers.
So the understanding is that you don't have an issue with the Cuban health professionals being in the country assisting. Your concern is unemployed health professionals, correct?
Yes, certainly we cannot have an issue with people who voluntarily want to give their life and risk their own lives to come and help our country. And we know that in our country we have shortage of doctors, and they are going to assist us in those needy areas and the areas that we may have shortage of specialists. So we welcome them, and we think it's a gesture that they are giving to us, and we appreciate the initiative by government. It's very much welcome. The however part is on the other side of the same coin, where we are saying the South African health professionals that are currently unemployed, some of which are doctors who completed community service at the end of the year last year, and in January they were told there's no employment. Those doctors still want employment, those who are still unemployed. Some are in private practice, but they wanted to work for government. Included among those is the nurses that have been told they don't have employment in areas of Limpopo, KwaZulu-Natal, and Free State. They still want employment and to help the country.
So reports that Denosa is saying that government is being unpatriotic by bringing these Cuban health professionals. You saying that's nonsense?
Well, we are not responsible for any journalism wanting to sensationalize stories of getting attention. However, we are not talking to the question of unpatriotism in terms of seeking help. We are saying by being a South African, it should not be a sin for one who's a health professional and therefore being disregarded if there is an opportunity to get employment. Right. Because we know that in the past 3 weeks, there has been advertisement for COVID-19 response. And to date, we don't know how many people have been employed, but we know that there's more than 100,000 of health professionals who have applied, and to date, they haven't been employed. And we're only saying government must come out clean and employ those and tell us how many they've employed so far.
Because the understanding is that the people that are here in South Africa from Cuba, they specialists. We're talking about physicians, epidemiologists, health technology engineers, biotechnology experts. So I guess that's one part in the fight against COVID-19. But you're talking about unemployed nurses, for instance, that needs to come on board in order to help out. How can they?
Well, let me accept that we have specialists that are running. We don't have enough in our country. I can give you an example of Limpopo. They only have one respiratory specialist. So if the specialists are coming from Cuba are going to add into those numbers, that is very much welcome. Among those coming from Cuba will be family physicians, but also remember, we need to be testing in villages. And this number of doctors will not be able to cover that whole area. Nurses who are available can be trained and go and do the testing, not only just the screening, but also to go and do the swabbing and sending for samples so that we can get testing of everyone around the country. So there's people who are available, including doctors who were let go in January this year.
I just want to get your sense before we go. We're running out of time, but with regards to so far in terms of government's efforts in the fight against COVID-19, we know we need to ramp up testing. We know we need to ramp up screening. What's your thoughts currently on how things are going?
Well, we receive reports on different areas on the ground. What we can say is that in some villages, in some areas, there's people who go there but don't really do tests, and then the screening itself because of sometimes they don't have adequate capacity, whether in terms of knowledge or in terms of the PPEs and so on. So we are saying if employment of available health professionals within the country can be taken with serious priority, those people can be able to function and assist in ramping up the screening and the testing within the villages as we speak. I do have voice notes of people who are concerned that they are not really seeing people in their villages, and we can maximize that.
Keep you here for a little bit, but we have to say goodbye to our SABC2 viewers. For those who have access to SABC News Channel, we will continue our conversation with the Denosa President. Welcome back. Simon Hlungwani is still with us. He's the Denosa President. Simon, sorry to interrupt you there. You were saying, just pick up on your last point with regards to how South Africa is taking the fight to COVID-19 in respects of testing, with the respects of screening. We know the mantra, especially from the World Health Organization, testing, testing, testing. What testing does, it sharpens our strategy, refines our strategy in this fight against COVID-19. Your take on what's happened so far in this country?
Well, so far, we think we are doing all we can, but we can as well maximize the potential that we have. We need more of health workers to get to the villages, to the townships, where they are going to be able to screen and test, so that we can be able to know that we have gone through. We wish we can get to at least more than 20% of the population within the next few weeks, so that we can be able to say at least the sample we have, it tells us of the seriousness of the disease, but also because we are worried that when we get to winter, it might give us a serious problem where we will reach a peak, because it will be time where people are having flus and many other illnesses. Yeah. As a result, we are saying whatever we are doing at the current moment, we just need to take an opportunity of maximizing this potential by using all available resources, including internal South Africans, because it shouldn't be a sin to be a South African and you're a healthcare worker, a professional, and you are unemployed. While we are accepting that even the Cuban doctors are very fundamental, because they are giving their lives and they're also not immune to the disease itself.
Yeah, there's no proven immunity anywhere in the world. You know, there's so much unknowns with regards to COVID-19. I was just saying 4 months ago, we didn't even know this disease existed. So we're learning every day. With regards to the fight against COVID-19, those on the front line, what are you hearing from your members about PPEs, these personal protective equipment? We know that South Africa received a number of donations with regards to masks, etc. Is it adequate? What are your members saying?
Well, there are areas where our members are complaining even now that they don't receive, or they receive restrictions from management in terms of the utilization. You might have noted in the Eastern Cape last week, where health workers just felt they cannot continue in an environment that is unconducive, where they are forced to touch patients without PPE. After they threatened not to continue working, the PPE was delivered. To me, that resembles the fact that there is PPE available. However, the distribution becomes an issue, and it differs from province to province. But we're calling upon government, all MSCs, not to play games with the lives of healthcare workers who are at the current moment in the cold phase and are committed to help the society in general. But then they expose them unnecessarily. We don't need a federal system where one province does what they do and the other doesn't do, but one does better and the others doesn't do. We just want proper PPE all over as per the recommendations of the World Health Organization, because only when we do that, we can prevent a spread to our own families, to other colleagues and other patients in this regard. So we're saying we must ramp up this thing before we reach a peak point. We must be ready, and every place must have PPE. Right.
So we're running a question on our Twitter page with regards to this issue, and reportedly Denosa was unhappy with the government inviting Cuban doctors. I think we need to reword this question now after our conversation with you. So let's put up some of the tweets and see what people have to say. Tabo is saying, I know and understand that South Africa and Cuba have a good friendship, but I'm 100% behind Denosa. How can you satisfy someone before you well pleased yourself? That's not fair unless if those doctors from Cuba have vaccine for COVID-19 that will help us as a country. As we know, Simon, there's no vaccine as yet. We are about 12 to 18 months away from that at the very least. Lachasa saying, hello, my lovely team and viewers. Hello, Lachasa. I do support Denosa because Cuban doctors will be paid millions of rands while our South African doctors are paid peanuts. How vital are Cuban doctors? Asked Lechasa. Let's put up Sakhwate saying, Tobela Ish. That's two sides of a coin with regards to the way the COVID-19 speedy running. We are, as South Africans, need to, and we needed help, but also local nurses should be considered, says Sakhwate. So, Simon, just some of our viewers think that you are unhappy with the Cuban doctors. Categorically state that you welcome them, but there are other issues.
Yes, in fact, we welcome them. Remember, if somebody gives himself to say, I'm willing to go to another country, risk my life, I may get infected, I may die. You must appreciate that person because that is a gesture that not ordinary person can give. So we welcome them and they're going to be helpful because we have a shortage in our country, but also for certain specialists. The other area is where we say it should be un-African and unbecoming for any South African healthcare worker or professional doctor, nurse to be staying at home with being unemployed if at the current moment they are not being considered. By the way, the cost for bringing those Cuban doctors, I'm not sure, but I understand it's not so cheap. So we are paying handsomely for their coming to the country. However, the gesture is understood and accepted. They are going to be receiving salaries, and the cost is very high to ourselves.
Simon, as we wrap up, I want you to put us in the shoes of nurses currently on the front line fighting this disease. What sort of stories are you getting from them, on a daily basis? What are they going through? Well,
one thing that came out clear and is very concerning and it's worrisome is that nurses are anxious and you have a fear of unknown, whether tomorrow you will turn positive. Some are worried because they see their own colleague testing positive, and they're worried whether they are next. And it's very painful because when you are in that anxiety state, there is not even psychological support from government at the current moment. We have made a plea to the minister to say, provide such psychological support so that people are at least debriefed when they feel in this way, because it's not easy to see people die in your hands and you don't know whether you are also going to get infected and so on. But also there are many other challenges that includes the question of transport at the current moment, which is a problem. Mind you, nurses are telling us they don't feel acknowledged, they don't feel appreciated, particularly because at the current moment they are risking their lives. They don't receive any risk or danger allowances. They're not going to receive any wage increase or salary increase for this particular year, according to what government has said. So it is discouraging without even this support that I'm referring to.
Look, our lives are interlinked. Our health is also interlinked, and we do appreciate the work that our healthcare professionals are doing, especially during this time, because there is so much unknowns, which leads to fear, anxiety, trepidation, etc., etc. Simon, we thank you very much indeed for coming on the program and giving your perspective and clearing up some of the issues that have been going around with regards to Denosa's position on the Cuban health professionals. Simon, thank you very much indeed.
Thank you very much. Welcome.
All right, that was Simon Hlungwani, Denosa President there.